talked about Ayurveda as a market, right? So now basically, can you give me the overview about the industry and what are the market dynamics that you might have experienced while being in the industry?
I remember I read an article about WHO, and it said like 80% of the world's population still uses traditional medicines in some form or the other. So one day I was just like, having like a conversation with a friend, and she was like, I want to have a startup. And she was like, can you recruit, like, can you get ashwagandha to me from India? And I was like blown away. It's like, okay, you need my country's ashwagandha, making money in your country.
Yeah, hi Mansi, how are you doing today?
Yeah, I'm good. How are you?
Great, great. So, before we start the discussion, let me set the context of the discussion first. So, today we'll be talking about what can we learn from COVID-19 and Ayurvedic perspective towards it, right?
Yeah.
And today we have Ms. Mansi Biyani, founder, CEO of MBDH Wellness, right? So, before we start the discussion, I'm curious to know more about your journey of the firm and yourself as well, right? So, if you can shed some light over there, it will be great.
Yeah. So like basically I'm an architect by profession, and I've like done my masters from the UK, and like a little bit from my family background. So like my family has been into the Ayurveda and the pharma business like since past 60 years. So it was like my grandfather who started it, then my father, and like, but somehow I chose a different stream of career. But it was just like in 2016, some 2017 around, like I was going through like markets and finding like a lot of my friends from the UK were using dietary supplements, all these people like plant-based solutions and everything. So one day I was just like having like a conversation with a friend, and she was like, I want to have a startup. And she was like, can you recruit, like can you get ashwagandha to me from India? And I was like blown away. It's like, okay, you need my country's ashwagandha, making money in your country, so I can, I do something and I have like a background and something. So I went into deep research and like trying to read like how's the market and what are the coming trends. So like it was a slow process going through that journey, and then switching over your career. Then I spoke to my dad, like, okay, there's a lot of scope in these sectors, and there's like a lot of untapped market in the international communities as well. And like people are going towards that vegan lifestyle, that plant-based solution lifestyle. So that was my like curiosity, which like completely like changed my course of career. And then like one day I just thought like, let's go for it. Like this is the that entrepreneurial thing comes into your head, like, okay, I want to do something and I want to make a change. I wanted to give something back to my society. If my ayurveda if my country's ayurveda is like so great and so scientifically like proven, then I should just contribute to it. Like that was my initial idea behind going through. And then like somehow the journey began, and like I like somehow there's like a lot of hurdles as well because of obviously COVID coming in between, and like a lots of like new things, because basically I was more based in the UK at that time. So I was typically I had that kind of mindset. But when you come back to India, so you have to come back to a developing society which is still learning to to be a perfect model for a business model and something like that. So yeah, that was kind of a journey. So like now I'm completely into so-called Ayurveda, and like trying to make a build a brand out of my like legacy which I have from my grandfather, plus also giving modern technologically based solutions to people who are like people like us, like millennials who have like different approach. They want different solutions based on today's lifestyle. It should not be like old age solutions which don't currently fit into our lives. So yeah, that was like a brief
Correct.
introduction.
Correct. So I'm sure it might have been quite a journey so far, right? So basically
Yeah.
transitioning the career, that too from very two different aspects like architecture and Ayurveda are something,
Yeah,
which are
but
very
actually I feel like it actually helped me, to be honest. Like whenever I used to interact with people, and when I used to share my story, so it actually helped me in a lot of aspects. Like being a creative person, it helped me in designing the products, even the packaging. Like if I give my packaging to XYZ person, he says that we don't see these kind of packaging. So I tell them that because I'm an architect, I have that small detailing factor in me, that I look things into very different perspective. And also, like if I'm not into this sector, it gives me an edge that I can see things from a different perspective. So I
correct.
feel like it gives me a better opportunity to work and make a difference. If I was somewhere from the farmer background, I could have just think in that similar pattern. So that was my thinking, that it's actually helping me rather than pushing me back. And in
Correct.
terms of clinical, I have people who are supporting me. Like I have like a good family background, so I have like good connections and good people to help me with that. So I thought that this is a complete package and I should go for it.
Correct, correct. That's quite interesting. So that brings me to my very first question. You talked about Ayurveda as a market, right? So now basically, can you give me the overview about the industry and what are the market dynamics that you might have experienced while being in the industry?
Yeah. So like the first thing which I was blown about was like I remember I read an article about WHO, and it said like 80% of the world's population still uses traditional medicines in some form or the other. So when I was not in this sector, I was completely off track. I never thought about it, but when I read that line from WHO, it made a lot of sense to me. Like okay, we are somewhere still into that places, like especially when it comes to developing and undeveloped nations. Like so that is one of the factors. And also like in these coming years, I like, especially after like 2014, there's like Ministry of Ayush, which was like incorporated by our government. So it pushed a lot towards Ayurveda and the Ayush sector. Also, like we are the second largest exporter of Ayurveda in the world, which makes us like completely like untapped market still there. And like also, like there's a lot of coming things which, like I recently read, like Indian government is trying to push and create a separate Ayush promotion export promotion council, which was still not there till 2022. So in terms of market dynamics, I think a lot of schemes, government initiatives. Like recently I had like visited on 20th April, said that there was a Ayush summit which happened, and an honorable prime minister was inaugurating it. And like a WHO plant in Jamnagar, and these kind of things are coming up. So it makes a lot of untapped and exponential growth for India. And also, like recently I came to know that there is no restrictions on foreign direct investments when it comes to the Ayush sector. So all these factors come together and make our Ayurveda a very powerful like growth sector in the coming years. So yeah, that's like complete
Right.
package. Even like for medical tourism, if you see like hospitals, clinics, and people from international, like from somewhere, if you are in like based in Kenya or you're based in Europe somewhere, you can come up for medical tourism, and our government is pushing that towards Ayurveda sector. So I think like it has a lot of coming up things for us, and in terms of products, in terms of tourism, in terms of like initiatives, startups, funding, and everything. So like I think that it's going to be the biggest sector in the coming years.
Right, right.
Yeah.
So I believe the legacy that India carries, that no other nation has that potential, to be honest, in this sector,
True.
right?
Yeah.
So now coming, that brings me to my next question. Like, how do you think how mature is the Indian market as compared to the rest of the world? So you might have, while doing your research, got to know about these aspects. So if you can shed some light over there.
So basically, I think that Indian market is quite mature, to be honest. Like when I think about it, so like I've traveled to like more than 30 countries, and like I really thought that our Indian herbs are going like getting sold in those markets. And if you cross check and you find that, because plants are everywhere, it's not like the herbs grow, and there can be different for different countries, but they don't have proper documentation. So we have our own pharmacopoeia, which is like very important to me as an entrepreneur. I need to get access to, you know, the documentation part. So I thought that Indian market is quite matured in that case. Also, like we have our own Ministry of Ayush, which is completely dedicated to our Ayush sector, which is completely lacking in most of the countries. And like there is like a lot of information where you can get access to, you can, you know, there's a separate entity which is working. Also, like there has been a lot of initiatives by our government. Like recently, if I can recall, in September 2020, there were like two parliament bills which happened to be in favor of the Ayush sector, which was basically promoting education in the Ayurveda sector, and also giving affordable medicines to everyone across the country, which I felt like it makes our market quite mature. Only my concern, which I actually read about, it's like our healthcare budget every year. So there's like a very less which is given to the Ayush sector. Like if I'm not wrong, I'm not aware of the exact stats, but it's something like only 5 to 10% goes to the Ayush investments, and the rest goes to the Western or the allopathic medicines, which I feel that should, you know, be equal to both, and that's how we can make more towards Ayurveda in the coming years.
Correct.
Yeah.
Correct. That's true. So now that I wonder, like, what are the challenges that consumers are facing in this industry? Like, you might have interacted with a lot of consumers, and you might have gotten to know about that challenges, the key challenges that the industry or the consumer is facing.
So basically, if I come from like the background where, like, you know, if I talk to people like me, so like if I'm talking to them that will you accept a solution which I can offer, so the basic concern which they have is like, will it work? So they have this question mark on them, because there has been a lot of, you know, bad uh, like reputation about Ayurveda, that it might work, it might not work. There's like a lot of counterfeit products in available in the market because of lack of regulations, which is one of the most important concerns about, like, with consumers, that they are not sure whether the brand is good enough or not. So this is something which I have been explaining to people, like why do that work. Also, like there's like a lot of problem with when it comes to the quality of raw materials, which as a consumer, a lot of people are skeptical about. Like, okay, we can trust your brand, but if you don't source your raw materials, right, your raw materials might be coming from an XYZ manufacturer of particular herbs. So there is a lot of problems when it comes to that. Like, people want to know more about it, like, or even if they don't know, they are using it. And you know, there has been a lot of cases where we hear like people have consumed some particular plant, and there are like side effects of that, because not every plant in every quantity is, like, you know, good for you. You have to, as a manufacturer or as a brand, you should be well aware of like which quantity and in which format it should be given to you. Also, like, one important thing which I came to know from people is like there is a lot of concerns with when it comes to metal toxicity. So which was something which I came to know that, okay, that's there, because in allopathic medicines you don't talk about these things, because these are basically, you know, prescribed by doctors, so you know that is going to be safe and you are in the safe hands. But when it comes to Ayurveda, like, there is a lot of, like, you know, unregulated market which consumers feel that they should be addressed. So that is one of the concern which I'm trying to solve as a brand, that I want to give people access to all the information which I have, and I am like trying to make you know, a better brand towards giving other consumer, the end consumer, the complete data. And also, like, one more thing which I felt like, because it's unregulated, there is like you know, there's like a lot of conceptions about magic remedies which I came across in the Ayurveda, and especially in the rural areas. If you tell people that, you know, there's some god or some like that, so I completely believe that Ayurveda is the science of life. It's basically all about science, no magic remedies and something like that. So as a consumer and as a as a person who wants to tell people the world, so that you should believe in the science and not about some magic remedies. And especially when it comes to international markets, like my friends or the people who I know who actually eat maybe ashwagandha or brahmi or any other herb, they actually know about the science. They don't have any other information regarding that, and these brands are doing well in that sector. So that's what something I feel like as an Indian consumer, people are still facing lack, and they should be given that access to what these people in the maybe in the international markets are doing.
Correct. Right. So I feel there is a little aspect of it where you need to educate consumers pertaining to Ayurveda and how it works, right? So I'm sure as a brand you also might have taken certain steps in that direction. Correct.
Yeah.
So now that brings me to my next question. Like, what is the solution that you are offering, and how is it different from other players who are out there in the market?
Yeah, true. This is the first thing which I made, I'm making sure it's like I'm putting clinical trials for the every product I launch. So I'm still not like finding any brand, so-called brand in India which is doing this effort to getting the science on paper and making it available to the public who can actually get access to my website, or they can just Google it and read about it. So this is my first priority that I'm pushing towards, that giving people proper clinical data. So for example, if you eat an paracetamol, so basically there is a data behind it, then only it came to the market and it's available to you. So I feel like it should be there for Ayurveda as well. It should not be a gimmick where people are just thinking in their mind that it might work and it not might work. So this is something, the solution, like I want to become India's first brand which has like proper clinical trials for every product it launches and has launched, and also like it's having safety protocols when it comes to international markets as well. Like we are working towards metal toxicity levels. We want to be free from heavy metals, which are major concerns in Ayurveda. Even like a lot of people don't know, like there's a term called bhasma, which is like in available in a lot of Ayurveda products, but that bhasma is basically metal. So you should be aware of that when you are consuming it, but not a lot of Indian consumers are not aware. So I'm trying to educate people in that factor. Also, like when it comes to solutions, I'm trying to make solutions which are new age. I don't want to give people the old, the basic solutions which they have been seeing for like many years. So for example, like we have come up with a product basically which is basically for your eyes. So you also, like everyone knows that after COVID everyone is like switching to online, and we are spending like most of like I think 10 to 12 hours of our day in gadgets and like everything. So there's like a blue light coming out of our gadgets, which is like creating a lot of stress and fatigue and dryness in our eyes, which can later on turn out to be a major factor in our when we go old. So I've come up with a solution which is basically for every age people, and it's considering that factors and trying to make a solution which is helping you to have your eyes getting protected from the blue light damage which is occurring in our day-to-day lives. So these are like some kind of solutions which we are working. And also like my concern was there, like why can't we use international markets well researched herbs in India? So like if other people can use our ashwagandha and our shilajit and our brahmi and our gokru and whatever like herb, and they have clinical data about it because we have done it, so we can also have those herbs which they have done it. We are in the international, yeah, we are in like 21st century, and we have access to the data and everything because of the technology. So why not have something which they have and mix it, or maybe have it in a combination with our herbs, and give our Indian people something which they can have more, more useful and more results, rather than just confining just to the Indian market. So that is also one of my that was some one of my things that I wanted to do. So I like, if I can recall, in 2019 I happened to travel to Africa, and during that time I met some pharmacists over there, and they explained me about herb, which is like very popular and very useful herb in their country. But because that countries, that they don't have proper research and clinical like studies and everything, it's like quite untapped. But in the local market, it's being used for like centuries, and like people are doing that. So I was very curious about it, so I just dropped, like I bought some in India and got it like done research and everything, and it almost took like 2 years for us to come up with all these data and everything. And we were shocked to see that okay, there's some herb which is like such good results, and why not like have a combination of our Indian Ayurveda with that particular herb, and give a combination to people which they have not experienced or not used till yet. So this is also something which I'm working on as a brand, to give people something which is not just Indian, but also like coming out from the different markets, which I can maybe explore in future as well.
Correct, right. So I believe research plays a crucial role over here, like you said, right?
Yeah.
It's all about, every country might have something or the other to offer, right? It's all about once you discover it and you research it, and then bring it to the public, right? So
Yeah.
I believe that's very crucial aspect of what a brand should do, and that's quite amazing. Right. So
Yeah.
I'm sure, COVID had impacted a lot of the industries, right? So I'm sure it had impacted in one way or other to Ayurveda as well, right? So what are your thoughts about that?
To be honest, I think Ayurveda has COVID-19 has given like the best to Ayurveda. Like if I can recall, like in from the immunity boosting supplements, people going crazy. Like for I think every household has made some kind of a kada in their COVID-19 pandemic. So I think it has given a major boost to the Ayush sector, and yeah, like the yoga and everything. And like thanks to our honorable prime minister, like he has pushed Ayurveda to next level, especially in COVID times. Like even the international markets have seen that how Ayurveda has worked for the India's, and like they have adopted a lot of things. Like I remember like my like friends from UK and US, they have been like using our spices and our herbs, and making those uh, so-called kadas, like and having it like our turmeric is gone like crazy. Like I have never seen such craze for our turmeric, like people having like turmeric lattes and whatever they can call for us, but it's like turmeric. And I have been fascinated to see that okay, my country's turmeric is getting such it's as being like a bestseller. If even I just I remember that when I was going through Amazon UK, and if you go into the supplement section, our turmeric is the best selling product in that section. So you can imagine like how COVID-19 has given such a important zone. And even like for, even if we consider for business purpose, I think that we have attracted a lot of investors when it comes to like for Ayush and development. Like if I can recall this 20th April investment like summit as well, there are like a lot of international attention we got from a lot of people, and it's all happened because of COVID-19. So I think that this was the best time to be like in the market, and COVID has given that push towards Ayurveda, and like the like maybe like yoga and other sectors as well. Like it's something which is like given us the opportunity to make standard Ayurveda in terms of the international markets.
Correct, correct. That's pretty interesting. So one last question for you is that you have been in this market since past couple of years or so, right? So how has the market evolved, and where do you position yourself in maybe let's say next 3 years? as a brand?
Okay. So basically, I think the market has evolved really nice. Like it has turned out to be coming out really, really good. I see a lot of trends also coming. Like for example, recently I was reading about a trend which was like combined therapy. So I see a I see a trend where people might consider like a combination of allopathy plus Ayurveda. So I think that trend would really work for India, because as a country I don't want to take one side or the other. Every aspect or every industry has its own plus and minus, and so we if we come out together, like the Ayurveda and allopathic, and we mutually have a combination therapy, that trend would be really nice when I look forward to. Also when it comes to like D2C brands, so like a lot of people told me like these D2C brands culture is like on its peak and like that, but still I feel like there's a lot of things to do, especially when it comes to tier 2 and tier 3 cities. There is a lot of untapped opportunities. It's still confined to tier 1 like metro cities, and there is a lot of work to do, and also in rural areas. Also I feel like there's a lot of untapped potential for telemedicine. So like still people are not into that thing, and I think that using your smartphone getting access to the India's best Ayurveda doctor, it's something going to be there for sure. It's going to be a major trend coming to. And also like as I spoke to you about clinical trials, I think that clinical trials are going to become a major trend for new age brands now. Like everyone would talk about it, and I see like major cloud based data coming in where everyone can put out their clinical trials and make their brand stand out in terms of other brands and other solutions which are there in the market. It's not going to be a hidden game, it's going to be a transparent game where everyone is competing with each other on based on science and not any gimmick or any other that kind of data. And yeah, like also I think like in terms of supply chain, there's a lot of scope for disruption. Like because when I see myself, like even if I have to like get some raw herb or something like a plant or something like that, there's still a lot of problems in getting the access to the right quality and the right standard in which format I want. So see, I can see a lot of artificial intelligence, I see a lot of technology disrupting the supply chain, where I can get the raw material directly from farm to factory and from factory to the getting the end product. And I see that there is a lot of trends and like a lot of work which is going to be there, and like artificial intelligence apps and like getting diagnosed on your smartphone, it's going to be the coming trend. And I see forward like working towards those like areas in Ayurveda, and also like smart solutions like that. And also like when I see myself, I think for me as in like I'm still focusing on building like giving new age solutions to people for now. Like for like the next year, I think like I want to add like more SKUs to my portfolio and grow as a brand, giving proper clinical trials. That is also my worst my major concern, and I want to deliver it to people. And with that, I want to scale up in India, and I see myself reaching to that 100 crore revenue mark in that coming 3 years. Also like I have like a lot of, since I have a lot of international background with me, like whether it was like living in UK and like people from US and like that, so I see myself tapping those markets as well. So like I have like a goal to at least start exporting to these countries. So and I have actually done so recently. Like I have like connections, I went to Nepal for travel and like business purpose, so I have like started working on that. And also like some of my products are getting registered in the African countries, so I'm looking forward for the export. And yeah, that's my goal for the next 3 years, like and of course like taking my grandfather's legacy. Like I want to give him, like he's no more in this world, but I still feel that I'm connected to him, so I want to like give him that pride that his granddaughter or like that, so giving him back his legacy, that what he has given back to me as a granddaughter. So yeah, that's something like I want to pursue in the next 3 years.
That's quite interesting, and with a lot of initiatives from government, and still the
Yeah.
untapped potential and a lot of growth opportunities being there, I certainly see that this is quite achievable. And I believe the work that you're doing is quite amazing, whether it be in terms of research or bringing new products to India, or mixing the cultures from different countries and bringing it to the people of India is
Yeah.
something which I believe is truly amazing and inspiring, right?
Yeah.
So that's about it from my end, Mansi. It was a lovely interaction with you today. So
Thank
thanks a
you.
lot. Thank you.
Thank you. Thank you. Bye bye.
Okay. Bye.